Hello and welcome to my video on proton pump inhibitors. I will provide an overview of this medication class for anyone interested in learning more about them. This class of medication is quite popular as they can be easily obtained without a prescription and they treat a very common condition. For whatever reason you are interested in learning more about proton pump inhibitors, this video should prove beneficial to you. Firstly, proton pump inhibitors are commonly referred to as PPIs, as I will call them during this video. There are a good mix of prescription-only and readily available PPIs. The main difference is that the ones you can buy without a prescription are usually lower dose. PPIs cause the stomach acid to be reduced and are used to treat conditions where lower acidity would be beneficial. There are quite a few conditions that meet this criteria. For the most part, we commonly refer to at least the basic symptom of this as heartburn. Now, a lot of things fall under heartburn: GERD or gastroesophageal reflux disease, peptic ulcer disease, and some stomach bleeding conditions, to say the least. Now, PPIs actually have a pretty simple way of doing what they do. There are cells in the stomach that pump protons. Protons are pretty much acid for simplicity's sake. PPIs grab hold to these pumps and stop them from working. And that's pretty much it. That is also one of the reasons these typically do not have a lot of side effects, because they work so simply and just do what they are supposed to do. Since PPIs are really the most potent, or strongest if you will, at reducing acid in the stomach compared to other drugs, it is apparent why they can and are used for pretty much any acid condition. Now, to fully appreciate this, I think talking briefly about GERD and peptic ulcer disease would benefit our discussion. GERD is the result of a muscle in the bottom part of your throat weakening or not closing properly. This causes stomach acid to climb up into the throat and the mouth. Now, obviously acid burns things, so it hurts the throat. This results in heartburn, nausea, cough, even chest pain, which can be mistaken for heart attacks sometimes. Other than the obvious issues of acid in your throat and mouth, this can progress to more serious conditions and even cancer in some cases. Using a wedge pillow can help with nighttime symptoms, and avoiding high-fat meals can also help reduce some of the discomfort associated with GERD. For mild cases, just using the non-prescription PPIs for 2 weeks at a time and no more than 3 times a year will do the trick, but more serious cases need a provider's care. There is also peptic ulcer disease. This is on a whole more serious because it results in ulcers or a deeper type of irritation in the GI tract. These can be anywhere from the throat to farther along in the intestines, so not only the stomach. These usually have a clearly defined cause. Typically, these ulcers result from certain infections, medications, namely NSAIDs, or stress. I do want to point out here that stress ulcers are not the result of mental stress, but show up in critically ill people, so typically not something you see initially in a non-hospitalized patient. Okay, now back to the PPIs. As I said, they are typically the best for any type of acid suppression, and the common treatment of prescription PPIs is for 8 weeks for things like GERD. This seems to be the most effective treatment course. After 8 weeks, treatment should be reevaluated, and if it worked, stop. For some people, their symptoms might come back, and that is when long-term use should be considered. The pros and cons need to be weighed for that, as we will talk about a little later. The main reason for 8 weeks is really to give the hurts and irritations enough time to heal before the stomach acid is reintroduced at a normal level. I will also point out that all the PPIs work pretty much the same, but someone might respond better to one versus the other. Okay, now let's get to the side effects for this class of medication. The nice thing about the PPIs, as I mentioned earlier, is that there are not a whole lot of side effects, especially short-term. There can be some headache, nausea, or diarrhea, but for the most part they are pretty mild and transient. Sometimes you might get a little more sensitive, if you will, to certain foods because of the lower stomach acid, but that's not really a side effect per se, just a dietary consideration. PPIs can also reduce iron absorption, so someone is more inclined to get certain anemias while on a PPI. Also, some drugs that need an acidic environment to work properly have a reduced effect, especially some delayed-release products. C. diff, which is a pretty bad GI infection, is a little more likely on a PPI, but it is not necessarily a risk factor for C. diff. Now, long-term use of these medications have had a lot of debate. As time has progressed, some conditions have been tied to the PPIs. I will preface this by saying the quality of the research has left much to be desired, but some of it makes logical sense, so I will now talk about the longer-term use considerations, which is typically using them for more than 1 or 2 years. Some big concerns are reduced absorption of key nutrients within the diet. B12 can be particularly relevant, as if this becomes a problem, it can lead to neurological disorders if it is not corrected. Now, B12 issues typically take longer than 2 years and can still be fixed once symptoms appear, as long as they are not ignored. Magnesium deficiency can also happen and in severe cases affect the heart rhythm, or even physical movement. Calcium is another major concern, as reduced calcium absorption long-term can cause osteoporosis or fragile bones, which in turn leads to higher risk of bone fractures. There has also been some talk regarding higher chances of getting pneumonia as well. To round out this video, there are a few quick facts which are good to know regarding PPIs. They are typically once daily medications that you take at breakfast. Now, they do work a tad better taken 30 minutes before, but that's not necessary for everyone. There are cases where someone needs to take them twice a day, but still fairly commonly used twice a day regardless. While these work best taken consistently and daily, they don't have to be. They can be taken as needed or for short bursts of time. And if calcium is a concern while taking a PPI, make sure to take a form of calcium that can be absorbed in a non-acidic environment, such as calcium citrate instead of something like calcium carbonate, which needs acid to be absorbed. Proton pump inhibitors are very common and used with and without prescriber input. They relieve much discomfort that people experience in regards to heartburn and can be used for a short period of time or chronically. With that said, I hope this overview of the PPIs has benefited you in some way or another. I do release videos fairly regularly on medications and pharmaceuticals. So if you like quick, concise overviews, I hope you subscribe so you can keep benefiting from my videos. Have a good day.